Well, in this week's Cardiology Countdown, it's ADA week with 3 big studies in diabetes that will likely help shape treatment algorithms. The first up is the Exes study that looked at what should be added to metformin as the next add-on drug. This was a randomized trial of about 1,000 patients looking at twice-daily exenatide, the GLP-1 agonist that's given subcutaneously, versus a sulfonylurea, glimepiride, and found that the exenatide did a better job at controlling glycemia. They looked at the failure of glycemic control and found that it was 41% of people by their strict criteria versus 54% in the glimepiride group. There were upsides and downsides. I think in the editorialists looking found that the low cost and prior track record of sulfonylureas are upsides, but hypoglycemia was more common with the sulfonylureas and not present with exenatide. On the other hand, it's parenteral and higher cost, although it did provide better glycemic control. But nonetheless, another nice study with exenatide showing its efficacy for glycemic control. Next up is the Origin study. This was a large trial looking at patients with impaired fasting glucose, looking at providing basal insulin as a strategy to try and, on the one hand, delay onset of frank diabetes, but also potentially improve cardiovascular outcomes. This study randomized 12,537 patients and provided insulin glargine to half the patients. And they found no reduction in cardiovascular outcomes with that strategy of providing basal insulin. They fortunately also saw no hazard and no increase in cancer, as had been seen in some observational studies. And so this study provides very nice safety data for a strategy of insulin glargine, but didn't provide much rationale for using it sort of prophylactically to try and prevent diabetes. There was a lower conversion to diabetes in the first 3 months, but balanced by weight gain and other issues with the insulin. The top pick this week is the Origin's fish oil component, part of the 2x2 design of this 12,600 patient study that looked at the use of 1 gram of fish oil versus placebo in primary prevention of cardiovascular events. Over a 6-year period, unfortunately, the fish oil did not reduce cardiovascular death or major vascular events, even though it had a very modest effect on triglycerides, reducing it about 14 milligrams per deciliter. This was a very nice look and a follow-up to Giussi Prevenzione, and doesn't negate the recommendations to eat more fish, where that has been a way to be associated with reduced cardiovascular outcomes, but is a bit of a damper on fish oil as a primary preventive strategy overall. So for this week's Cardiology Countdown, I'm Chris Cannon.